Welcome to CoexSpace Global Summit, where we remember, reflect, and act. This is a place to inspire and make a call to action to change the world. Welcome, Milton Wainberg. I'm so honored to have you here at CoexSpace Global Summit. I'm really honored as a therapist, as a psychologist. I'm really honored to hear from you and know your visions about the world right now and how can we envision the future and how can we become agents for good. Welcome.
Thank you so much. Thank you, Vivian. Gracias. It's a pleasure to be here and to hopefully contribute to this amazing opportunity to try to coexist better.
Yeah, that's right. As you know, we're here at CoexSpace Global Summit, where we, talk about memory, reflection, and a call to action. How can we go to our past so that we can reflect and go forward and envision a better world, better humanity? And I would like to start talking a little bit about your career for those who don't know you as I know you. And I'm very glad to be here with you because you have done so many good stuff in the psychiatrist, educator, and implementation of science. And you're a bilingual. You're from Caracas, Venezuela,
Mhm,
and you earned an MD from Universidad Central de Venezuela, and
mhm,
you completed a postgraduate training at Mount Sinai in New York. You're a professor of clinical psychiatry at Columbia University in New York State. And right now, you're the director of the Mental Wellness Equity Center at the Global Mental Health Initiatives at Columbia New York University,
mhm,
and you lead major training programs, including NYMH founded T32 Global Mental Health Implementation Science Fellowship and Fogarty founded program for Portuguese speaking African countries. You will then describe a little bit of the work you do. Right now, you work for the American Psychiatrists Association. You have done many projects in opioid addictive personalities, addictive behaviors, and how can we work for the interventions for those who are in need. And you authored more than 250 papers, over 8,300 citations, and that reflects the impact you have done globally in mental health. And you have worked in HIV, the stigma research, and behavioral interventions. Milton, you have done so much stuff in the mental health, and I'm, like I said, very honored to be here with you working. I would like to start asking you, what has been a turning point in your life or your career that changed the way you see the world?
Okay. First, thank you so much. You said a lot about me. One little correction. I don't work for the American Psychiatric Association. That's an organization that I do work with them right now we're working in developing the new diagnostic manual, but I don't work for and so you mentioned my academic career, and for me, more important than that is the impact of what we can do and to make sure that it is sustainable.
Yeah.
Because a lot of the things that we do, we invest, and then we don't think of how to maintain it. It's like when people diet, right? They diet for 2 weeks, and then 5 weeks later, they're already not dieting. So the maintenance is sometimes more important and more difficult than the beginning. So, what was a turning point? Going to your question, a turning point was that I worked in the system of care as a clinician, and I would see that people here in New York, where you're supposed to have access to care, people would have to wait to see one of us, and then either they would not show or they would stay, a few sessions and would not continue. And if they stayed, the treatment was not really tailored to their needs and to them. So I was hoping to make changes within the world of clinical care. I found resistance left and right. So my turning point was I need to do something that is more public mental health oriented. And that's why I became a researcher. And my research is not one disease, it's all diseases in mental health and comorbidities, that are very highly associated with mental health, or there are consequences of mental health and substance abuse. So for me, the goal has been how you implement what we know works in systems. That could be many different systems. It could be systems of care, mental health care, schools, you name it, communities, and to think from a sustainable perspective. So, not just, oh, let's do something. If I can say what's the most important part for me is that I go in thinking that I don't know nothing of where I'm going to work. I listen and consider, which is what I do. And I think it's something that we need to do in general to be able to work together and learn from one another. It's to listen and consider. And in my science, I listen and I work with you in trying to figure out what you need and how do we implement it. And then I can think of, what do we do that it's sustainable, et cetera, et cetera. So the turning point was being in a system of care that was not providing proper care and realizing that we needed to change something. And in mental health, there was a huge study that started in 1990, which is called the burden of disease studies, that all the diseases were put, and burden is, how many years you are able to live with the illness and what are the disabilities that you have because of the illness. And they measured that as burden, which impacts not only the individual, impacts the family, impacts the community, impacts the economy, right? Because if 20% of the population cannot work, that means the economy is affected. And one of the few diseases that has not changed in the burden of disease being number one and number two everywhere in the world is mental health. Any mental disorder. So we have created so many amazing things. We don't use them. And then we don't change. So the public mental health need is everywhere, it's global. And that's the work that I do that I love to do. And I get to know systems in many different places.
Yeah, Milton, we're going through change in the world. We're in times of change institutionally, especially, like you said, in societies globally. How do you balance that work with institutions and the way you see the what's going on and what we need, and how the systems of power wants to, get through that, and how we can do that turning point so that we really get to change and to health for the patients you have and for, the society in order to do the real change.
It's a big question. And it's not an easy question. And it's not, I could tell you something that it's a miracle and I would be faking it. For me, it's important what I mentioned about listening and considering. Systems have their ways of working. And to transform them, you need to be able to be part of that system. And in many places that I work, I'm not part of this. I'm not from Mozambique. I'm not from Brazil. I'm not from Spain. I'm not from South Africa. I'm not from Thailand. So I try to come in with a humble position that tell me more about you so I can understand your needs and what's feasible and possible. I always try to bring in all stakeholders that can be brought in that are the important ones for the maintenance. So, for example, the work that we do, I incorporate patients, people with lived experience, we call it, families, community, government, providers, administrators. So they, number one, educate me. Number two, they listen to one another because they haven't. And I put them in the room together to learn from them, but they're also learning from one another. And one of the reasons why I do that, we call that participatory research, but it's every science creates their own name. For me, the valuable part is also then it becomes their baby. It's not mine, it's theirs. And to be honest, I don't know that I will have all the answers. And if I don't know something, I'll bring somebody. I'm very collaborative and I don't pretend that I know it all. Quite the opposite. I pretend that I know nothing so I can learn much more. So each system has a very different way of interacting and respecting each other, and and how you do that. And I try to listen and consider the best way and stimulate a process that is respectful, but absolutely with the eye in the horizon. What is it that we need? We need to improve access. We need to do early detection and early intervention. We need to provide support for the people surrounding the individuals. And not everybody needs the same treatment, and which is what we do in mental health, unfortunately. Everybody, there are treatments that are short, that are effective, and it's not either or, it's about continuum of care. So it's about really trying to figure out how to tailor your need. Because if you are a working mother with children, can you really come once a week for a year? No. And one of the things that we're also trying to invest is figure out how technology can be of help in the elements that we're doing. So it's about listening, considering, and having an eye on the horizon to be sustainable what we do. So it's not about let's do a pilot, let's write a paper. It's more what needs to be done to help your system. And it's very different in different places, but we have ingredients. It's how you put the ingredients together, in what order, who's doing what. And more important, and as important, is the world doesn't have enough mental health specialists. And we're not going to be able to train all the mental health specialists that we need. So we believe in training people who are not mental health specialists, lay workers, and there's plenty of data that works. So to help us with the people who have low levels of disorder, which means there's more access to care, which means these people are not waiting in the same line with the people that have very severe disorders, which means you're going to be seen in 6 months. So, for example, when we started the work in Mozambique, we were seeing thousands of people very quickly. I was like, oh my God, how are we doing that? We develop a system that can take care of thousands of people very quickly and still provide excellent care. So it's not that we are doing low quality care. And because of that, New York State asked me, can you bring this to New York? The problem here in New York, it was wait lists, because what happens is that you have a mild depression and I have psychosis. Both of us are waiting in line for months to see the therapist or the psychiatrist. And the reality is that I'm the one with psychosis. I need faster care than you. You're depressed. Doesn't mean that it's not important. So what we created in Mozambique, that it's provide care for in New York, it's how to help triage and determine who can be seen by a layperson very well trained and who needs to be seen by the mental health specialist. And when they gave me the funding to do it, they said you have 3 months to give results. And in the first training, we have 3 therapies that we train people into the lay workers to do. In the first training, we're eliminating wait lists because we started taking away those who don't need to be seen by the mental health specialist immediately, that was seen by a lay provider, and those lay providers are supervised by the mental health specialist. So if there's a need to move you up to be seen, it's easy. And we do short-term treatments. And then, again, I don't know if I mentioned this before, not everybody can come weekly for care. You work, you have children. How do you do that? And so we use what we know works, which are short-term treatments, and you can do them again. It's not like goodbye. We engage people in care, we follow them across time. So it's implementing something where there's more resources, different than when there are no resources, yet they both function. And we use technology to make sure that there's rigor, like the interventions are using something that help you make decisions, so you're not doing it on your own. And I can tell if you saw me for 3 minutes or you saw me for 3 hours, and if you use properly what you need to do, because the technology can tell me that. So I hope that I answered the question because we got a little lost because of the issues of the Wi-Fi.
Yeah, I was going to ask you about technology precisely because we're getting to the AI era and the technology times. And how do you balance technology with a person to person connection? And what type of technologies are you using? maybe you can give us an example of the way you use technology to treat person in such a, profound way to help individuals in these, specific manners.
A great question. So I'm going to tell you chronologically how I did it. So the first, I like rigor. I have seen, I worked in the HIV epidemic, and many people, sub-Saharan Africa had the highest rates of HIV, and mental health was an issue. And what ended up happening that many people got trained to do a therapy, but nobody uh, was able to figure out the rigor, how it was done, and supervision thereafter. And what happens is that when people love what they do, sometimes they change it because they think they can do it better. But when changing it, they actually may be eliminating what works of the intervention. So
Hmm.
my first task when we went to Mozambique is whatever interventions we're doing, we needed to digitize to help the lay provider follow up what they need to do and help them in the rigor of the intervention. We can adapt the language, we can adapt other things, but the rigor we keep. So that was my first. Then we develop a new method of assessment that it's very quickly. I can ask you 3 questions, and with those, I know that I need to ask you 10 more. If you're negative in the first three, no, I don't need to ask you, so you don't have any disorder. And because comorbidities are very common. So the idea that I can ask you with 13 questions and immediately know what I need to focus on. Also, what we created the technology to do it faster. And what we're doing now, there's something that we always talk about, which is prevention, which we don't know. We don't do very good prevention. Early detection. We wait for people to come to us. We don't go to them. So in that measure that we created, we decided to also test it to be able to interview you about people in your family, 3 items, 3 questions. And with that, we know if we need to go to that person. So the other person is not seeking care, we go to that person. And that's early detection. And we can do an intervention if there's a problem. If there's no problem, no problem. And so what we've done with technology is being able to link all of that. Early detection, early intervention. We're also now incorporating other technology in how you use your cell phone without asking any questions and totally anonymous. You are, depending how you use your phone, it creates a norm. And then we can tell when it's different. And that is associated with depression, anxiety, stress, and even ADHD. And this is biologically oriented too. So this is not just, I work with Behavidence, and this is an amazing team that looks into this. And actually, there's an application that it's out there, but we're trying to bring it into the system of care so we can tell where you're at, so we can follow you across time without even asking you questions. So you don't need to see me to tell me what's going on. And if you give me permission to see it, I will know. And we're also, there have been millions of apps created. All the apps are created. Not many mental health people are involved in the creation of the apps because there's some interventions they invent them. And others, they're easy to be programmed. But they're not really addressing disorders. They're addressing a little bit of what's going on. And sometimes it's not very rigorous. So in what I just told you, we do early detection, early intervention. And in the early intervention, you may need you may need to see the layperson, or you may need to see the specialist. So in the little, we are trying to create an AI chatbot to be able for you to do some of the work on your own. And we can identify if you need more. And then we suggest to you, Milton, it's important for you to be seen with somebody. You may decide no, but we give you the opportunity. And that's in the treatment, early detection, early intervention, and across treatment. We're also working with some Israelis in doing using AI for scaling up training. It's very hard to train at large scale. And you depend on the quality of the trainer and the bias of the trainer. If you have a bias and you go and train somebody that it's in your bias a problem, which is coexistent and co-space, we create AI that helps with the training. There's still a trainer that oversees everything, And so we're enjoying being able to use AI in a very methodological way, always reviewed by mental health specialists who are experts and not just doing things for doing it. So I'm having a lot of fun, I have to say.
I love it. I love what you're saying because there are many points of views about, technology, AI. I would like to ask you what is your personal point of view of AI as you've been talking about it? If it's a positive aspect of humanity, if there's a negative aspect for humanity about you know engaging in so much technology, what has been your approach, as a therapist with your patients going through this usage of technology with a cell phone and with all these beings spending so much time in laptops, technologies, Instagram, every time you spend there, what has been the results of that, mentally speaking?
So there's a lot of research trying to look into that, and it's definitely the new era, right? And we cannot go back. The boat left, the train left, so we're already there, and it's not just youth. Everybody is involved in that. For some people, it can interfere with their lives. For some people, it may not. Just like alcohol, right? It can be an addiction, but if you have a drink here and there, and it doesn't affect your job and your relationship, nobody should tell you stop drinking. And people are going, it's also like dieting where nobody can tell you don't eat anymore. So nobody will tell you don't use technology anymore because that would be crazy to tell somebody that. So the first thing is to figure out how it affects the individual. So it's tailored to the individual. And then it's about trying to, so there's the treatment where people are already doing it and how do you work with them? And some of the things that are used for substance use can be used, motivational interviewing and helping people. Eh, I also think that, and that's technology in general, not necessarily AI. I think that we will need, part of the issue here is that some people that I work with, they used to be in one big company. I'm not going to name it so nobody gets upset. And you know this, that, when you're working in your computer, you get an ad of something that you fantasize that you would buy and you were not thinking about it, and somehow the computer knows. So there are many ways for companies using AI and reading all the work that you do to determine what you want and what you like. And, they can bring you through a rabbit hole that you stay in the same and you get more of the same, of the same, of the same. Until we don't have a social conscience into trying to figure out how those companies can still make money and work with us in how to not just uh, stimulate that you buy, stimulate that you stay in the same mentality, but try to do a little bit of balancing the act with things that you may need to know. Uh, we have not been creative enough in providing this to them. I believe with AI we could, but we need to put our act together to do that. With regards to mental health, for me, AI needs to be supervised by people who understand what may be happening and not just anybody doing it, which, because it's easy to do, why not do it? But the consequences could be complicated. So it's the new world, technology and AI. And so we need to figure out how to work with it. It's like, if you don't figure it out, what are you going to do? You're going to go back. You can go back from the telephone. Can you back from the cell phone, from the refrigerator? You're going to, you need to take the advantage, but creating a social conscience with those who are involved. Perhaps where we're at in the world, I believe that these companies are going to have to start looking at what they can do. Maybe they're very self-involved and trying to figure out how to make money, but we're seeing the consequences of lack of truth, uh, no facts being used, and turning populations to do something that it's based on lies and creating groups that are unable to listen to each other. And this is influenced by the technology that we use, because if I put you in this rabbit hole, you're going to hate me, and you don't even know me. You've never had a conversation with me. So uh, I do think that this is something that we need to invest. I'm not an expert in how to do that with them. I wish I could have an opportunity to knock at their doors and tell them, can we work on not trying to create hate and difficulties? And it's based on people not knowing. People don't know you and have assumptions about you. And when they meet you, it's like, oh, I didn't realize that you were whatever could be the stigmatizing issue. So stigma and discrimination is based on bias more than experience. And if you're taught by your family the stigma or the bias, and if you are like involved in technology giving you huge more of the lies to give you more stigma and more discrimination, it's going to be very difficult to turn your back because you feel that you have the facts and you don't. But we need to figure out how to do it. We cannot just go blind and say, no, I cannot tell anybody, don't use technology or don't do this or don't do that. The more you tell somebody don't do it, the more they will.
Yeah, I can see that, especially with my kids, that's a close example. It's very easy
I'm
to,
going to say all of us were that with our kids. And I'm glad that you said it before I said it, just in case my children listen to this, to make sure that I don't get in trouble with that. It's true. It's the new world, and we all have to start thinking about it. But they're big people who really need to start thinking about this in a way that perhaps you and I cannot do. But maybe with this we can start something. I don't know.
Exactly. And that's part of the goal of this, summit, to inform and see the other part of these technologies, these how can we use in a positive way, spending time watching something that really can give you the truth and good information for you and make you feel good in another way. And it's just not another addiction or something that you just consume and make you feel emotions that or make you bias that alternate the truth of the world, or coexistence or a better interaction with the people you are surrounded with. So that's exactly what we're doing this summit, and I'm glad you mentioned it. I wanted to ask you precisely, what's your point of view about coexistence? What is your definition of coexistence as a psychiatrist? How can you tell other to coexist even with the people in at home, your husband, your wife, your kids, or with the others, even with the people you don't agree with?
It's a tough question, I have to say, number
I
one.
know.
And my children would say that I don't do it properly, like your children
Me
probably,
neither,
eh,
exactly.
because that's part of adolescence and separation and individuation and getting to be a person. Eh, I think that there are several issues that are very important that I have learned through my life, and also by my own example of like my biases. What I said before about giving an opportunity to the person to be who they are and tell you, and for you to get to know them, is basic. Because if I walk into the room already thinking negatively about you, and what happens also is that, minorities, when they walk into a room, they expect sometimes that they're going to be mistreated, and they can misread some of the. It has happened to me that I'm giving a training and there are two people in the back that are like talking all the time, and I'm saying, "Oh my God, they are, my accent, my this, my that," and it was stupid because at the end they said, we've been talking here because we love so much what you're doing that we're trying to figure out how we're going to use it. So I completely misunderstood the behavior that they were having, and so bias is tremendous, and for me it's always listening and considering and including my patients, because I may be very judgmental if I don't listen and consider. So coexistence requires, you have the same rights I have as I have. You have the ability to have your voice and express it uh, without doing something to me with that. This is not about hurting, it's about expressing yourself and to be able to listen and consider and to come from a perspective that what I want to do, which is very hard sometimes, uh, it's not about what you're doing wrong. It's what about what you're doing that it's right and how I understand more what you're doing. And for you to understand, it has to be bilateral. This is only with two people. So in general, it requires an effort. One of the difficulties is like, disrupting or creating chaos or destroying is much easier and much faster than building, right? I in 3 seconds can say something to you that you will not talk to me ever again. But if you and I want to have a conversation that lasts and will lead to change and improvement, we have to invest much more. And some of what's happening in the world is that some people are destroying so many things, and then you have to rebuild, and it will take time. I'm hopeful. I still believe that we need to find who are the people who we can do this together with. So you have to find partners that are willing or that could be willing. And there's some partners that we will not be able to reach, but that's okay. They're the minority. What happens is that they may have an influence of many others. So there's some people who are on your side already, but there's some people who need to hear more, need to listen more, and need to be listened to. Because there's also reasons why people become who they become, and it could be that we're not paying attention to them properly. So people come with their quote unquote injuries, or they're feeling disregarded or not paid attention, and it's much easier to complain and to do something. So we need to listen and consider and engage as many people as we can in that. Not easy, but it can be done. And that's a social action that needs to be created that I know you guys are very interested in doing.
Yeah, that's precisely what we are willing to do and, make a movement because we know, like you said, we're hopeful and we believe in the humanity essence. As the end, if you see kids have that, they basically, and you as as a scientist of the brain and human essence, you know that kids, you can see they have this willing to help others. They're open, they're humble, and until they get those bias and they start to build those paradigms and build those beliefs about the world. So we trust that if we make these communities and movements towards good, towards the better future, we can build a better way and balance the lack of information, this mistrust, mis ways we've been seeing in the world, and this opportunity that we have right now. I'm really, really humble that you've been talking about all of this. How can we see your work? How can we engage in this AI you're talking about? If this is a question for you, how, if I'm not involved in your programs, can we all get to those technologies?
So, first, I want to say something about what you just said that I think is very important. I agree with you. Kids are born and they are a vessel that wants to learn, and we can teach them, and whatever we teach them could be positive or negative. I also, what I mentioned before, that it's not only the bias that it gets to be, but the feeling that somebody's paying attention to you is very important. And if your needs are not met, you're going to find scapegoats to do.
Mm,
Some people do it, as a strategy to divert from the problems of society, government, whatever. And some people, it's because they really feel that nobody cares about them. And then it's much easier. Oh, you care more about this and about this and about this and about me. And that creates so. That's where we need to pay attention to everybody. Of course, there are going to be people that, no matter how much attention we pay to, they're going to continue with the quest of whatever they want to destroy or however they want to do it. So, going back to your question about access, the way, so at one point, some of the things we're developing, so they're not ready. You know, the evidence is already an application that you can go into. That's not my work, but I'm collaborating with them. My work is not only about the individual, it's about a system, it's about a program. And I don't want to train lay people who are not supervised to do the work. So anything that it's about training, it has to be within a system. I don't want to train a layperson that then does private practice or have clients within. So they have to use the technology within a system. They don't have access to it if they're not properly supervised, because I want rigor, I want quality care
Mm-hmm.
for everybody. So those platforms that are already developed, I only use them when there is a system that I know it's going to be used. So I don't only train the individual, I train the supervisor and I train the system in how to use it, because to improve the patient outcomes, they're getting better, the services, and how it gets implemented across time. The other things that we are developing could be used. We're not ready with them. Hopefully, we will be soon. The training, it's easy to, but you still need a trainer. So, because I'm very interested in quality, I want to make sure that when we do trainings, we have quality too. So, the AI of training has to be done also. I know I have friends that say, oh, please train me so I can help people. I cannot do that if I don't know that you will be supervised, and I cannot supervise, all over the world.
Mm-hmm.
We are trying to create, the program that we have in New York is called Engage. In Mozambique it was called Pride, their name that they chose. So Engage now is sort of like the label. So we're trying to create Engage in Spain and Engage in Thailand, Engage in Israel, Engage in South Africa, to be able to have a center of training and supervision and rigor. The early section of things, early detection and early intervention for people who don't have disorders, that will be available as soon as we have it. We're in the process of developing it. Uh, and But right now, it's more about creating a system that gives you more access for people who need care than just out there. But it will come. Maybe next year, if we talk again, I will even show you what we have.
We will be expecting, we'll put all the information about the work you do and the links to your work, because we believe mental health is part of the crisis right now, especially, that addictions, depression, anxiety, all you mentioned earlier. So we're very grateful for the work you're doing in globally, and to listen to the point of view you're saying about, we are where we are. We cannot change that. We cannot change. We are in the era of technology. We're in the era of the global movements. We are developing new ways of dealing with stuff, but the main point is connection, as you said,
Mm.
putting attention to others, to ourselves, and understanding that that's where we can start,
Mhm.
and that it's true, and being humble. Being humble, I get that.
Absolutely. I love what you guys are doing, because you're bringing very different people with very different backgrounds to do this, which is exactly what I love to do in many places. And I have to say, my first work started, I listened to anthropologists, sociologists, people with lived experience and families. For me, that was the most fun. I know medicine, but for me to learn, and I think that the joy that hopefully people would learn from one another and whoever is watching. And what also it's very funny, in many times in my career, people who don't talk to each other, either because they're competing institutions, blah, 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 because I bring everybody together and everybody says, no, you're not going to be able to have them all in the same room. and I manage because, like, I want to learn from the two of you or the three of you. And it's so much fun for them to realize that they can do this together. And that doesn't mean, the competition is in not in everything. You may want to do here and there. So I love that you guys are bringing, multiple stakeholders, and hopefully in the summit you will identify who else you need to bring in that you haven't. And maybe that could be a phenomenal outcome, right? Who are we not engaging in the process? And I mean you or us, because I'm part of this now. Who we're not engaging in the process to make sure that the process not only continues but grows and inspires to do more. So I'm hoping that in the summit we're also listening and considering, and not just be proud of what you need to be humble. We don't know enough. We need to learn more, as you said.
That is correct. Thank you so much. Thank you so much for these words. Those are true. That's our hope, our view. And all of us listening to you, we're open to those ideas. And hopefully you listen to the other interviews. And thank you, Milton
I will.
Weinberg. We'll continue these conversations with you. Hopefully next summit, where you have your technology ready for us, so that we can be engaging and getting better mentally and physically and socially. Thank you
So
so much.
thank you, Vivian. I love the interview and how you led it. And thank you for all of you who are organizing this beautiful vision and beautiful hope in a humble way and are trying to make a difference. I really appreciate being part of this. Thank you so much.
Thank you, Milton. Bye bye.